All right, cool. So just try it again, I guess. I don't know I'm not super great at introductions. I guess maybe you should do the introduction.
What else do you
Uh,
want me to do?
Obviously, your real name is not Muffins, but we're gonna do that for anonymity's sake.
Yeah.
20, from Colorado, my home state. Um,
Also, you
yeah,
can
so I
dox
mean,
yourself, but you can't dox me.
I can exactly. I don't want people doxing me.
I
What are
want
you,
people
3 years?
doxing me. Maybe I'll find some friends.
At least someone cares. Yeah, but let's just keep it loose. Just like basic
All right, let
conversation.
me take off my
You know,
pants.
doesn't. Okay, I like it. So, uh, kick it off. Tell us your story.
Are we introducing me? You
Right
little
on the
fucker.
spot. Yeah, I roughly did. All right, so just when did this start, more or less?
Is this what's going live?
I already, in-
Is you're not introducing
yeah,
me?
it's been live for a while. I already introduced you. You just didn't catch
Okay, okay, I'll take your word for
it.
it. Um, all right. Well, it all started probably about when I was hitting puberty. Uh, I started to really struggle in classes and stuff, and I ended up once I was like starting to really struggle with classes, my parents finally realized something was wrong, and we took me to the doctor. The doctor thought that I had generalized anxiety disorder because I was fraught with anxiety, and he assumed that was the sole cause of why I was struggling in my classes. So he put me on medication for anxiety. It turns out several years later, I found out that the whole time I'd actually had inattentive ADHD, which is kind of led into the anxiety. Um, because of how much ADHD made me struggle with focus and stuff, that made me really anxious because I really hated doing badly in school. But at the time, it just looked like it was only anxiety, so we did not know that for a very long time. And as a result, the anxiety medications really didn't help because it wasn't addressing the problem at hand. So over time, I just started getting worse and worse. And what was anxiety and ADHD led into major depressive disorder. And as that started to happen, I just started to struggle so much in classes that I just began failing all my tests, and I had to drop out of a lot of the classes. Eventually, it got to the point where I wasn't really doing any schoolwork at all, and I was maybe showing up to a few classes just for the sake of showing up. But I really wasn't accomplishing anything, and I was just under constant stress because of it. And I ended up dropping out of high school as a freshman, as an early freshman. So
Hmm.
that was how it all started.
So, okay. So, what was like the interactions with teachers like, with therapists? Was the counselors involved? Any sort of thing that helped, or you just kind of void and kind of left alone?
My parents really had no idea what was going on, but they were trying to help me. They weren't like some parents where they were dismissive. They were trying to help me by taking me to doctors and therapists. But if I ever tried to talk to them about it, they really didn't get it. Um, and they would kind of just tell me to take it to my therapist or something like that. Um, and my teachers were kind of in the same boat, I guess. I didn't have any teachers who really ridiculed me for it, but they didn't really understand what was wrong with me. They didn't really understand why I was doing poorly in their classes because it seemed like I was trying, even though I wasn't getting anything done. And my experience with medication and therapy at this time in my life was pretty mediocre. I had some anxiety medications that maybe would calm me down a little, but it was just a little bit of a band aid. It didn't actually solve the problems that I had. So it wasn't great. And therapists weren't great either because since it was mostly a chemical problem from hitting puberty, I didn't really have anything to talk about with a therapist. So I kind of would just go there and be like, I'm really anxious and I can't get any schoolwork done, and the therapist would be like, well, have you tried this breathing exercise? And I'm like, yes, that's what we've done every week for the last month. So that was kind of what therapy and stuff was like at the time, and it just kept getting worse from there. And it started morphing less and less. It became less and less about the anxiety and ADHD, and more it just became a pretty dark depression.
Okay. And so, what did therapy look like for you across all of those spectrums? Because that sounds like some pretty basic CBT, anxiety management stuff mixed with medication, right? But I know you have some
Mm-hmm. Yeah, so
other therapies that you've gone through.
early on it was CBT, some basic anxiety medication. I ended up, I can't remember when exactly this was. I'm trying to go a little chronologically here because I tried a lot of stuff over time.
That's okay.
I remember that at one point I ended up admitting myself to one of the local psych hospitals because I had been planning my own suicide, and I had a little lapse in how bad I was feeling, and I could tell that I was in a pretty rough spot, and I decided I needed to do something about it. So I admitted myself to a psych hospital, but that psych hospital was not a very good one. And what ended up happening is I immediately just lied to them and told them that I was fine in an attempt to get out because it was so bad. I remember my sister called me while I was in there, and she said that all she could hear in the background was just like other kids screaming and stuff, and it sounded like it was completely out of control. Um, which,
Jeez.
unfortunately, some psych hospitals are like that. Though later in my life, I was in another psych hospital that was significantly better. Um, so they're not all like that, but the first one I went to definitely was. I also tried
Okay.
some dialectical behavioral therapy at one point, some DBT, but at that point I was kind of too far gone, I think, to do DBT. I was in a state where I really had no motivation to do anything, and DBT requires you to be at least somewhat motivated because you have to you're working on a lot, I guess, with your illness. So I remember that just made me worse, probably, to be honest. When I tried that, I probably quit it within a couple weeks because it just was not something that would work for me at the time. Um, yeah, I don't know.
And so, like, for someone, since you've been at a bunch of therapy, and I know that, what has worked then, or made at least some sort of positive impact on your life? Medication, person, therapy, whatever.
Um, so after I had done a lot of therapy and medication, I ended up going to an experimental program in Mayo Clinic, Minnesota, to try a treatment called transmagnetic stimulation, which consisted of basically sitting in a chair for an hour and a half every day for 6 weeks and having a big electromagnet stuck to my head, which sounds a little odd, and it was, but it just involved sitting there basically every day, and it was incredibly boring, especially since it was the middle of the winter in Minnesota. And that treatment also, it didn't have any negative effects really, which was nice at least, but it didn't really work for me either. It was kind of it was kind of like a shot in the dark for the doctors because they're kind of running out of options, and sometimes people who have been resistant to medications like I was, that can be a good treatment, but it didn't work for me. So I went back home and kept trying medication for a while that continued to not work. Eventually I visited a new psychiatrist, and they approached me with the idea of electroshock therapy, which um, a lot of other psychiatrists, it was a bit controversial among all the psychiatrists we talked to, But because we had completely run out of ideas, we had pretty much tried every therapy and medication that we had access to. I decided that to try electroshock therapy. So I ended up going to University of Michigan, where they had an, um, I guess, I guess it was a study on the effects of electroshock therapy for teenagers, because I was only 16 at the time. Um, so I went to University of Michigan as part of this study and underwent electroshock therapy, which consisted of it consisted of basically waking up at 6 a.m. in the morning, um, getting on some hospital bed, and then getting put under this anesthesia, and then getting electric shock to my brain that resulted in a seizure. And the seizure stimulates activity in the brain, which can result in some. It kind of works like a hard reset does for a computer or something. It just stimulates the hell out of your brain, and doctors
Mm-hmm.
basically hope that that's enough to pull you out of whatever place you're in. So I did that,
Yeah.
and I did that 3 times a week for a month straight. Live in a psych hospital for the entire duration, um, and ended up having about, I think it was about 23 total treatments, um, which really sucked. it it was awful, as anyone could really imagine, and I knew it was going to be awful going into it, so that didn't really take me off guard, but it still sucked. Um, and
Well,
sorry.
so I mean, one of the things obviously with ECT is it's controversial. Still tends to be controversial. You and I have talked about that
Mm-hmm.
before. And so, as far as I know, it's made a positive impact on you, right?
Yeah, I was
Um,
getting to that. I was
so I don't know.
mostly
Okay, go
yeah.
for
I was
it.
giving you the context of what
That's
had come
fair.
up to that point, I guess. But yes, even though it did really suck, it had ECT has a bit of a weird thing where it doesn't take effect right away. In fact, during the ECT, a lot of people feel worse than before they started it, which I did too. It leaves you feeling very kind of confused and dazed. But it has this effect where once you're done with the treatments, it has, you just slowly start to feel better over time. And so over a course of about 8 months, I ended up getting significantly better to the point where, I mean, before I went into the ECT, I was at the point where I really almost never left the house. Even doing something like, I know I was working with my therapist, and she wanted me just to go on a 15-minute walk every day, just on the road, just go outside for 15 minutes every day. I didn't even do that every day. I could not get
Hmm.
myself to do even the most basic of tasks. So I went from that state
Hmm.
to about less than a year later being like fully functional almost. Um, and a little over a year later, maybe about 2 years later, I moved out of the state to Colorado and went off to college, which is, I mean, over a course of 2 years after being the way I was for, I don't know, 6 years or something, to go from that to being a fully functioning adult so quickly is really great. It's really great.
Yeah, I
The
bet.
treatment really helped. I don't want to give the impression that it didn't help, um, but
Hmm.
it was rough to go through. But that's by far the most effective treatment I've ever had.
Hmm. Yeah, and I wonder if potentially that in terms of the reset, that like perhaps physically it helps, but like you said, it was 6 years of living under constant depression that you have to overcome 6 years of behavior, um, which I guess unless you're focusing on that, that might be part of the negative outcome. of the ETC, just because you're not having that reinforcement and changing of, new behaviors, and you're going outside and you're eating correctly and all that stuff.
And
I don't
what
know.
helped is before doing ECT, I had set up. I think if someone had a depression or had depression for only a year and tried ECT, they would probably quickly relapse because they would have, like you said, they have those bad behaviors that would just drag them back down. But I had been working with my therapist throughout my depression on improving those behaviors in little ways. Like, one thing that I haven't heard many people say that for me was actually pretty long lasting and I think quite helpful was my therapist would have me always keep my head up because I was very nervous and shy all the time. And so I'd kind of pull in a little bit, where I'd, I guess the classic shy person thing where you have your head down, you're looking at the floor, and you're kind of like pulled in. And my therapist would always have me kind of, I guess, pretend to be confident by having my head up, looking straight ahead, looking people in the eyes, and like keeping good posture. And it's little things like that that we built up over the course of the 6 years that I think really stuck with me and helped. It helped me significantly overall, actually, even though it seems really small. Little things like that kind of trick your brain into being not depressed, I guess, if you act like you aren't depressed. At least it did for me. So, yeah, I think it worked quite good in that sense.
Yeah, I haven't heard that, but that definitely makes sense, just because that's part of the serotonin response. Just posture-wise, that's actually interesting. I don't think I've ever heard it being used in therapy. That's kind of awesome.
Yeah, and it's not like that completely. It's not like that changed me all that much, but it's a bunch of little things like that. When you do a ton of them, they add up into being quite hopeful overall. So, yeah.
Well, cool. So then, coming to the present day, long-term impact therapy, all that stuff, and obviously not expecting that battle to be ever finished, but what are you doing today? What's your day-to-day look like? What are you currently struggling with, that kind of thing?
So now I no longer really just struggle as I no longer really struggle as much with my depression as I used to, because I mean I was probably like basically suicidal for 6 or 7 years straight, and I don't ever really feel suicidal anymore, which is a pretty drastic improvement. Now I think most of what I struggle with is my symptoms of ADHD. So I tend to really struggle with things like focus and motivation more so than things like feeling sad. Uh, in fact, I wouldn't really say I feel very sad much at all. Maybe I have. I think I might still maybe qualify for depression, but it's so mild that, especially in comparison to what it used to be, that it doesn't really bother me anymore. Most of my problems are like things like, I don't know, getting out of bed in the morning because I just don't feel like it, or things like focusing while you're at work or going to school. Things like that are mostly what I struggle with now, the symptoms of ADHD. And I'm handling those better now too than I used to, since I probably got diagnosed with ADHD when I was 17 or 18, which is a little unusual. Usually people get diagnosed with it when they're like 12. But we just didn't know that I had it for so long. And so over the last 2 years, I've been trying more things to treat my ADHD instead of treating my depression. So in a way, I'm kind of treating the root causes of my problems now, versus when I was treating my depression and my anxiety, I was more treating I was treating the symptoms of the problems, I guess. So now it feels like I'm kind of much more under control of it than I used to be, since I know what actually I need to focus on. So, yeah.
Yeah, and that's interesting.
It's definitely a lot better.
Yeah, so one of the theories I've heard is that basically you have your normative behavior and then you start developing anxiety. And then if that worsens, it turns into depression, which is why you see a lot of like the comorbid anxiety depression,
Hmm.
where you can still like, you can fix the depression, but then you still maintain some of that anxiety. Which I guess that would kind of propagate that theory
Well, and
a little bit, but
something my
just interesting.
psychiatrist said to me that I found very interesting in that regard. Uh, this is my favorite psychiatrist that I've had, I think, because she tends to take very unorthodox methods of, I wouldn't say treatment, but she just looks at things from just,
What do you mean?
well, for instance, she
What
said
do you,
that
yeah.
whenever she gets a kid who comes in with anxiety, instead of immediately checking the anxiety symptoms, the first thing she does is she always checks the kid for symptoms of ADHD, because she finds that more often than not, when a kid with ADHD comes in, it looks like anxiety, because it was similar to me where the symptoms of the ADHD were making me so anxious that from the outside it just looked like I had anxiety. So, like you said, it tends to be that one thing leads into the other, and so the root cause of the problem is not getting treated, and instead of trying to treat the symptoms of the problem.
Hmm. Sorry, someone apparently is running the sink. Anyhow, duh, duh, duh. So this therapist better than the previous ones. Sounds like specialized more in your ADHD anxiety side of stuff, which is beneficial. But outside of therapy, what kind of positive activities uh, kind of helped you maintain function or order? You know, give you some sort of benefit.
Um, for me, it's just a lot of it's just keeping busy. If I if I don't have school and I don't have a job, I tend to relapse quite a bit into my symptoms. Um, a lot of it's keeping a structure and keeping busy. So I try my best to wake up at around the same time today. I always try to go to bed before a certain time. Um, I make myself always go to bed before 1 a.m. because if I don't do that, I'll sometimes just stay up till 5 a.m. doing whatever the hell for no reason, and then completely regret it the next day. So I force
Yep.
myself always to keep a schedule in pretty much every aspect that
Mm-hmm.
I possibly can, because it seems like the more I structure my life, the the more in control I am of what I'm doing, the better off I am mentally and emotionally. Um,
Mm-hmm.
and then I try to just do things that I find fun. So um, where I can, I try to hang out with friends, and I try to go rock climbing. I haven't. That tends to be the only sport that really interests me. But kind of lost my train of thought there. Got distracted by this
That's all
computer
right.
screen.
Yeah. Right.
Yeah, that train
Well,
of
yeah.
thought's
So
gone. That's out of here.
keeping you busy, that's fine. ADD. I get it. All right. Well, thank you for your time. Is there any, if there was a book, film, song, anything that you would recommend to people? Doesn't necessarily have to be related to mental health, but if it is, you know, by all means.
Um,
It also doesn't have to be serious.
Mine probably is related to mental health, uh, but that's just because I think it was the most impactful to me in that way. Um, if you haven't seen it, which I'm sure a lot of people have seen it, I would recommend seeing the Pixar movie Inside Out, because
Mm-hmm.
I love the way they represent emotions and mental illness. I actually, the first time I actually saw that movie, I was when I was receiving electroshock therapy. It was the first time I
Hmm.
saw it. They showed it in the psych hospital that I was staying at, and it was funny because the psych hospital integrated it into their activities. They so they would like show you. They had everyone watch the movie, and then they'd like have you do these little games with like what emotion you were. I was like, yeah, I'm the blue one. I'm just.
Nice.
I don't know, how do I get rid
Just
of it? How do I make it run away like it did in the movie?
Yeah, actually, I saw that movie and I hated, what is it, Sadness? Yeah, I hated Sadness. The whole movie.
Fuck
I was
off,
just like, I wish he
Sadness.
would die. Yeah, and like the end of the story, they're like, you need sadness. I was like, no,
No,
you
you
don't.
don't. Get rid of it.
No.
No, that was
Get
that was
out
I
of
think
here.
what
No
I
one likes you.
that was I think what struck me the most about the movie though is in the movie. Well, I don't want to spoil it too much, but Sadness does leave for a
If you
little
haven't
bit.
seen Inside Out, it's been like,
Yeah, I'm
it's
guessing
been
a lot
3
of people have
years,
seen
so
it, so it's not a big
screw you.
But in the movie, Sadness leaves for a little bit, and when Sadness leaves in the movie,
Good times.
the main character does not feel better; they feel numb, and that actually was probably the thing that struck me from the movie the most, because with my depression, it got to the point where I really didn't feel sad. It was just kind of like this dull, painful numbness, which was
Mhm.
honestly probably worse than sadness. So when I got to the point where I felt sad again, I actually felt a lot better. And that's, I think, what struck me the most about the movie is a lot of times depression's portrayed as just someone who feels really sad all the time. But for me, it felt a lot worse than that. It was like this horrible, numb, dull pain in my brain at all times. It just wouldn't go away.
Yeah.
So that's why that movie struck
That
me.
was definitely something. Yeah, I believe it. I guess now, having had some time and doing my own reading, you do have to have sadness just because suffering tends to be an integral part of existence. And I mean, it's like haha, but if you follow like Viktor Frankl, his conclusion was if it's all going to be suffering, then how do you bear it? And and then how do you find joy in the struggle? So I guess there is some merit to that. I think I was just really upset that sadness survived.
You just wanted to fall
Just like
into that
throw her
pit.
out. Yes, I did.
Joy, just
Like,
fucking
go
give
away.
her a nudge. Just send it.
Yep. Later, bitch. Well, cool. I think wrap it up right here, right under the 30-minute mark.
Nice.
It seems
That's enough to get the YouTube ad revenue.
treat you okay. That's all that matters, right? It's all that matters. You hear me? It's all that matters.
It's that sweet, sweet AdSense.
Alright, well, cool. I'm just gonna hit the stop